Welcome, Royal Minds, to another episode of the Behavioral Health Queen, your safe space for leadership, strategy, and soul in healthcare transformation. I'm your host, Dr. Teranda Knight, Doctor of Behavioral Health. Today, I'm talking about something that is reshaping the future of healthcare: integrated health solutions. This isn't a theory. It's evidence based, it's urgent, and it has the power to transform how patients heal and how providers lead. So join me today as we talk a little bit about physical health and mental health. Have you ever felt like your physical health and mental health were treated as two totally separate worlds? Yes, I'm pretty sure you have. So, what is integrated health? Let's talk about that for a minute. Let's break this down. Integrated health solutions combine physical health and mental health under one roof, one coordinated system. No more bouncing between clinics, no more gaps in communication. And here's an example. Imagine a patient that lives with diabetes and depression. Many times we know depression can be associated with physical ailments and also with medication as a part of the side effect. So diabetes, knowing that the individual also has depression, we can actually look at it in the whole system, okay, instead of the old way in the fragmented system. In the fragmented system, they see one doctor for the diabetes and another for the depression, who may or may not even talk to the other provider. But in an integrated model, that same patient has a unified team: primary care, behavioral health, maybe even a social worker, all sharing the same plan. And guess what? Studies are showing real results. In 2022, a study of veteran affairs patients found that clinics with integrated behavioral health achieved better blood sugar and blood pressure control than those that was without it. That's whole person care in action. No more of that fragmented basis of care. So why integration matters? The why is the most powerful basis of understanding integrated health. And when we look at it, well, integrated health leads to better communication between providers, improved patient satisfaction, and most of all, low cost, because prevention and early intervention stop bigger problems down the road. For example, a 2024 trial with Latino adults managing diabetes found that integrated care with mental health support led to lasting improvements in both physical health and anxiety. Yes, that is tremendous. That's huge because it shows integrated care isn't just about medicine, it's about culture, equity, and real world change. I'm just asking that it incorporates a new model. Well, it's not new, it's been out for years. I actually found a book that was published just on the natural healing, and it's called the Complete Encyclopedia of Natural Healing, and it's by Gary Null. He's a PhD, and this book that I found was exceptionally old, and I didn't even realize the importance and correlation of our nutrition, or at least our deficits, and our actual health outcomes. However, this book was originally written in 1998. I'm going to say that again. 1998. Wow. It's been over a decade. And we are still not taking this approach seriously. This book has all types of ailments in it, from alcoholism to AIDS to anemia to arthritis to back and neck pain, breast cancer, cancers in general, colds and flus, dental problems, diabetes, digestive issues, fibroid and uterine bleeding, gallstones, even down to herpes and menopause and strokes. This book has a whole list of different types of diagnoses as well as treatments for the patient that does not require prescription medications. Yes, I'm going to say it again. Does not require prescription medications to treat. We have been going about healthcare in this really unorthodox way. Imagine this: you get sick only because your diet changed, and you may end up catching something from someone else, which you're conditioned to believe that you caught it and that it has to have a medication to get rid of it. Whereas in reality, it just means that your body was missing something that it needed. And that's what this book is about. Let's look at this. A randomized trial in 2021 tested measurement-based care with clinicians with feedback on patients' progress in wellness. And the results were patients had better symptom outcomes and fewer breakouts. So we know that combining the professionals and using a collaborative team model is important to their outcomes, but we also need to recognize how diet needs to be incorporated into that as a first line of defense in treating various different medical conditions. So the science is clear. It isn't just good policy, it's good practice. Now, when we think about this, challenges and real talk, let's listen. Let's keep it real. Integration isn't always easy, right? Because we gotta have professionals that understand how to communicate amongst their teams and be effective in the treatment outcomes and creating the plans needed to treat the patient. We face cultural differences between medicine and behavioral training. And we face reimbursement issues sometimes insurance doesn't want to pay for both. And all, of course, there are shortages in mental health providers. But here's the good news. These barriers are solvable. Telehealth is closing the gap. Medicare Advantage is now reimbursement integrated behavioral health. And usage has grown eightfold in just a few years. And here's something I want you to think about. When leaders commit to integration, they're not just changing clinic operations, they're transforming lives, and that takes courage, persistence, and vision. Think about your own physical and mental health. See where the two can coincide with each other and how having providers that can collaborate in one space that's treating you for your ailments all together beats the odds of treating them separately. Imagine the removal of redundancy where you have to keep saying the same things over and over and over again. That's powerful. So how do we move from theory to practice? Here's some proven steps. The first thing is assess the needs and gaps. So look at who's falling through the cracks. And then secondly, build diverse teams. Primary care with mental health, with care coordinators and social workers, all working together. And train continuously on cultural competence, screening, and integration workflows. The fourth factor is leverage technology Shared electronic records and telehealth is important to meeting the needs of the patient. And then finally, measure outcomes, because what gets measured gets improved. If we're not measuring it, we're not identifying and connecting with it, which means we're not gathering what we need to know if it's truly working or not. And remember, integration isn't just a policy, it's a mindset. Every professional has to see the benefit in taking this approach. So we stop thinking about patients as diagnoses and start seeing them as a whole human being. Here's my challenge to you, if you're listening. I want you to get in the comments, and thanks for joining. I want you to comment on one way you think healthcare can better integrate the mind and body. Write it down or share it here, because I would love to know whether you find it to be exceptionally important, if you feel like nutrition is exceptionally important in the process. I want to hear from you, because it's important to make that connection and understand not just for your health, but for those that you love and want to be around as well. Integrated health is one of the greatest tools we could create. But as any process, humans can definitely change its outcome with how they approach it. So we have to make sure that we have healthcare providers that is well educated and come with this love of trying and being able to do new things. Now, to my royal minds out there today, we're at a crossroad in healthcare. Integrated health solutions are not just the future. They're the now. The research is here, the models exist, and the transformation is possible if leaders are willing to lead with strategy, science, and soul. So I leave you with this one question. Are you ready to be a part of the community? If today's episode inspired you in some way, I want you to take the next step and dive deeper into integrated behavioral health, leadership, and transformation in my book. You can find it on my website, www.virtuallyrenownedconsultantaccessllc.org/bookstore. And don't forget, follow me here on Podbean, but also across social media, Facebook, Instagram, and TikTok, for full conversations and to actually have interaction. And if you haven't already, go to my website, www.virtuallyrenownedconsultantaccessllc.org/challenges, and go ahead and join the 5-day Reclaim Your Time, Energy, and Peace today. It will be there after this week. We're completing the 5 days. It will be there for the continuation. It is 100% free, and you can receive a certificate for completion. It comes with information to help you navigate and think about things differently over a 5-day time period, to get your mind to think about things that you can work on in your consultation and coaching session. It comes with great tools and resources that you can utilize as well throughout the year. So thank you guys once again for joining me, and together, not just talking about change, we're creating. And remember, never leave the beast, never pass the beast. Work hard. Until next time.